The sole of the foot. The sole of the foot, here we see this is the plantar aponeurosis, which is a modification of deep fascia of the sole. Now here to see this I have cut the skin. The skin of the sole, both epidermis and dermis, are much thicker and devoid of hair and sebaceous glands, but it contains the more numerous amount of the sweat glands. Next, after removing the skin, the superficial fascia will be seen, which is composed of subcutaneous fat which anchors the skin to the underlying plantar aponeurosis. Now this is the deep fascia, which is the plantar aponeurosis. This plantar aponeurosis is composed of compact bundles of collagen fibers which are seen longitudinal in appearance and consist of three parts. It has got three parts. One is the central part. This is the central part, which is very thick, and it contains a medial part and a lateral part which are relatively thin. And the central part, if I reflect the central part, you can see a muscle which is the flexor digitorum brevis. This is the flexor digitorum brevis. This is okay. Next, if you see the medial part and the lateral parts of the plantar aponeurosis, they are covering a muscle. This muscle is abductor digiti minimi. So the lateral part covers this muscle, and the medial thin part will cover this muscle. This is the abductor hallucis. Now, the attachment of this plantar aponeurosis, if you see, it has got two parts. Which this is the narrow posterior part. This narrow posterior part is attached to this bone, which is calcaneum. It is attached to the medial tubercle of calcaneum, and anteriorly, if you see, it is broad. And this will split into 5 bands. You can see it. You have, this is one band, this is one band, likewise this is this and this. So we have anteriorly this broad end of plantar aponeurosis is split into 5 bands for each digit, and each slip is again divided into a superficial strata and a deep strata at the heads of metatarsals. The superficial slip or superficial strata will blend with the dermis of the skin and superficial transverse metatarsal ligament, whereas the deep slips or deep strata will blend with deep transverse metatarsal ligaments. And not only that, the medial and lateral intermuscular septas will be extending vertically deep into the sole from the junction between the central part with the medial and lateral parts of plantar aponeurosis and divide the sole into compartments. Now this is all about the plantar aponeurosis, and this plantar aponeurosis has got some functions, like it maintains the longitudinal arches of the foot, it provides the origin for the superficial muscles of the foot, it protects the vessels and nerves from compression, and not only that, it is also making subdivisions and compartments of the sole. So this is all about the plantar aponeurosis. Thank you.